Hi everyone, this is Mr. Neil Writer, also known as the Wax Whisperer. Thank you for tuning in to my latest video. For anyone who doesn't know who I am, I'm a UK-based award-winning consultant audiologist and clinical ear care specialist. As an audiologist, my main duties and roles are the diagnosis, treatment and rehabilitation of people suffering from hearing loss and balance disorders. And as a clinical ear care specialist, I specialise in the removal of impacted earwax, foreign bodies, infected discharge and debris from the ear canals of people. We have a client here who attended with bilateral impacted earwax due to the misuse of Q-tips, or cotton buds as we call them in the UK, and this is the right ear, and you can see the indentation made by the Q-tip, and this is compressed right up against the eardrum. So contrary to myth, cotton buds, Q-tips are not advisable to be inserted within the ear canal. If you look at the packaging on the fine print, it explicitly states, please, they've got a disclaimer on there, please do not insert in the ear canal or up the nasal cavity or nostril. Cotton buds only push the wax further in your ear if you've got a substantial build-up. I know some people feel as though cotton buds keep their ears clean. When you're using a cotton bud and you're spiraling it around near the entrance of your ear, what you're actually doing is scraping off the surface wax that's coating the ear canal wall, which is actually healthy wax, it's not occluding wax. You may be lucky in that also you may have some sticky wax, so when you pop the cotton bud in your ear, it sticks to the cotton wool, and when you bring it back out, you bring a large lump out. The odds are that's probably only 10% of the wax, the other 90% you're pushing further in. So this wax is really impacted. It's been in the ear for a long time. It's oxidized, it's very dark in color, and because it's stuck to the eardrum and it's actually lodged within the isthmus and in the anterior recess, which is a little cave, a little trench to the right of the eardrum in the case of the right ear. I just put some olive oil drops in there just to lubricate it, to get a suction grip, because it was really impacted as well. The surface of the wax was very flat and there was nothing really for the suction probe to grip onto. We do have to be extremely careful when we're removing wax off the eardrum, because if that wax is impacted and there's no suction grip, when you place the tip of the suction probe onto the wax, because there is no suction grip, you're actually pushing the wax further onto the eardrum, causing more distress and discomfort to the patient. So olive oil always helps, or even sodium bicarbonate drops. It helps when you've got wax impacted with the drum. You can see that we can see the inferior posterior quadrant of the eardrum, which is the southwest region there. Just working at the top just to lever that. You can see the image is slightly blurry, still see what I can do, and that's just the oil. When you've got oil in the ear, even if you drain it, sometimes it does get a bit blurry, and more often than not, it's the hairs near the entrance that's coated with the oil, and when you insert the endoscope through the opening of the ear canal through those hairs, you get a bit of grease on the hairs that settles on the tip of the endoscope. So sometimes you just have to come back out the ear if you feel the view's too obscured, wipe the lens with an alcohol wipe. You can see there we're working in the anterior recess region. There's some dead keratin skin that's adhered to the wax and also the ear canal, so I'm just trying to loosen that. Again, throughout the procedure, just making sure with the patient that they're comfortable. Not only are we working in the inner 2/3 of the ear canal where it's just skin on bone, so it's very sensitive, but we are directly on the eardrum. It's a big lump of wax here, and if we are applying pressure the wrong way, so if we're, as I said earlier, if we're not getting the correct suction grip, we're only pushing it further in against the eardrum, further compounding their symptoms. So the oil has helped, mind you, soften the surface of the wax and getting some purchase, some grip here with the suction probe. So just some general ear care advice. The old saying that don't put anything smaller than your elbow in your ear still applies. Please do keep your ears clear of any foreign bodies. The only real thing you should be putting in your ears is if you wear a hearing aid, or if you're using drops on a regular basis, or if you're wearing noise protection, ear muffs or swim moles, swim plugs. Otherwise, please do and try and keep your ear clear. Your ears are self-cleansing, so the skin that coats the ear canal, as it sheds, it naturally migrates out of the ear. It's a bit like a snake skin. It's got that unique ability to do that. If the skin doesn't have that unique ability, everyone's ears will be blocked full of dead skin every 2 or 3 months, and it will need professional cleaning. So the ear has adapted, it's evolved. That skin, it sheds, it migrates naturally out of the ear, and then you've got another layer of skin that's secreted. So it's like a conveyor belt, and as that skin migrates, it takes with it any small pieces of wax that may be attached to it. So it is self-cleansing. So you can see we're just bringing this forwards now. I think I've just leveraged it off the eardrum, so it's not in contact with the eardrum anymore, but it's still lodged within the isthmus, which is a narrowing deep inside the ear canal, about a centimetre or half a centimetre away from one's eardrum. And just making gentle circular motions with the suction grip. And because the wax is quite hard, as we're bringing this forwards, you can imagine the wax itself, it may be coming in contact with the canal wall. It might be a bit coarse, so again it can be a bit uncomfortable for the patient. Not able to use any of the ENT micro instruments. An ear hook, you wouldn't be able to remove that because you're going to have to literally make contact with the canal wall, and when you get in behind the wax you'll make contact with the eardrum. Similarly with the Jobson horn and forceps, there's nothing there. There was no tail end of the wax for me to grip and pull out, so the only method of removing that was suction. Just some remnants superiorly on the roof of the ear canal wall, not really significant, it's not going to cause any hearing loss or any symptoms, but whilst we're there, just attached a fine end gauge. We're not going to remove every little speck of dead wax and skin off this the roof of the ear canal, but just removing the larger chunks. Having a bit of wax is healthy, guys. Wax is slightly acidic. The acidity inhibits certain bacterial growth and reproduction. Also, the acidity is believed to help repel insects, creepy crawlies from entering the ear. Wax is slightly greasy, so that greasiness coats the ear canal wall, the skin, preventing it from drying and cracking. And also, wax is quite sticky in consistency, so any pollen or dust or foreign particles that enter the ear, it sticks to the wax, and as the wax naturally migrates, it cleanses the ear of all these foreign particles. So wax is actually good. Obviously, when it comes to the point where it's occluding the ear canal, it needs to be removed professionally. Finished the right ear, the eardrum is nice and healthy. So similarly, now with the left ear, just put some drops in straight away. The wax here, it's like a thin sheet, like a disc of hard wax. Again, it had been pushed into the ear using a Q-tip, what we call cotton buds in the UK. It's very difficult to remove hard disc of wax because again, you're not getting a suction grip. So what I've done here, I've gently applied some pressure with the suction probe on top of the wax, on top of the sheet, and with the oil, you can see it actually went back in there inadvertently. I'm just putting a bit of pressure and actually using the suction grip not only to suction this disc of the sheet of wax and dead skin, but also almost gliding it out using the surface of the suction probes and using it in two ways. So this is almost out of the ear. You can see there's a bit of cilia there that's coated with some olive oil drops that I put in. Just gone back in with the fine end gauge here. So you've got some wax directly onto the eardrum. Just like the right side, it's been there for a long time. It's oxidized. The wax has almost turned into a black color. Here we're just working at the base of the ear canal in a region called the annulus, where there's a bit like a trench near the eardrum. It's very difficult to get a suction grip, and when you do, if you move the suction probe out of the ear too quick, you lose that grip like I just did there. And if you don't get the correct suction grip, you're just going to be pushing this film and disc of wax further into the ear canal against the eardrum. So I'm just working around the wax, trying to find a place where I can get an adequate suction grip. I think I've just taken the fine end gauge off here and just gone with the big sucker to get a more surface area grip. Again, just in the annulus region, just being very careful not to make contact with the ear canal wall. So you can see there, because I didn't get the suction grip, I'm actually pushing that wax a bit further into the ear, so we just have to be careful. Just having another look, re-evaluating my options. Can't use any other instruments again, an ear hook, Jobson horn, or forceps. There's nothing there for me to grip onto. I can't really get in behind the wax with an ear hook or Jobson horn because I'll make direct contact with the eardrum, which would be very uncomfortable. So I've just got a grip and I'm just being very slow in removing it. So if I tried to remove that, extract that wax too quickly, I would have lost that suction grip. So I was almost hovering over the wax. Sometimes slowly but surely is the best way. There's that wax. So there's a bit of wax again on the roof of the ear canal wall, just using a fine end gauge. There we are, nice and easy. And you can just see that amazing view with the endoscope. So if anyone who's watching this who performs ear wax removal with a microscope or head loops, if you compare that view to the view you can get with an endoscope, it's unparalleled. There's the remnants. You can see there 2 large chunks of wax, a sheet of dead skin that was from the left ear. Hope you enjoyed that video, guys. If you're watching on YouTube, please do subscribe to the channel, select the bell icon so you'll get notified as and when I upload new videos. Similarly on Facebook, please do like, follow the page. Feel free to share, like the video and leave comments in the description box. Thanks guys, bye.